Hey, I want to talk to you if you're considering possible knee surgery or you feel like in the future that you might be looking at a knee replacement or a total knee replacement, right, for a new joint. And that can be a partial or a full. If you are, I want to tell you about this research that I was reading. So with this research, it shows that 29% of savings can be had for the people that do pre-operative physical therapy and treatment prior to your surgery. If you go through this, you often save more than $1,000 on the back end of what you actually need therapy-wise after. So one, you might be feeling like, oh, I hurt a little bit more. Why do I want to have exercise and rehabilitation now? I should just save all those insurance dollars and save that and my deductible and everything for after surgery, right? Well, it's actually a little bit of a misnomer because you truly can save over $1,000 and have fewer visits and better recovery. When you have a knee surgery, a lot of people don't realize the trauma to the knee joint for them to replace that joint. And what happens is you have swelling, you have stiffness, you have pain. And those are all part of the process of recovering and rehabilitating. I find that a lot of people don't realize the extent that that's going to be until after they've had the surgery. Not to dissuade you from it, because if you need it, then maybe you do in fact need it. But try some of the pre-operative therapy first and save yourself some hassle on the end and that backside when you're not feeling so well. So I also want to share with you that the study estimated that there was a 29% reduction in post-operative care in the people that got physical therapy after. And that was driven by reduced payments because people didn't need to go to skilled nursing facilities. They were able to go directly home, and that helped save money. They also think that the preoperative therapy before surgery was mostly preparing people for the surgery. So they studied it and suggested that the value of it was primarily due to your training on walking devices, so you can already learn how to walk with a walker. You can already learn how to walk with a cane. You can start building some of those motor patterns and learning how to move and how to move better with those before you have pain and swelling and it's hard. And they found that planning for recovery and managing patient expectations and not from multiple intensive training sessions for range of motion. So it shows that you can have a reduction in those post-acute sessions, so those immediately after surgery sessions, if you do it before. So as payments in healthcare are going to go from more of a fee-for-service to global, you're going to want to manage your overall total dollars and consider using part of that in that preoperative phase. So if you have more questions about this, I'm Dr. Shari. I'm an orthopedic physical therapist with Athletity Movement Clinic, and I'm here to answer your questions if you have knee pain, if you're considering a knee surgery, a total joint replacement, or if you're looking at what your treatment options even are, and you want to go about this the right way without missing any steps or wasting money or wasting your time. So reach out and let's chat about what your individual situation is, and I can give you some feedback. I hope this helps today. Have a great day.